I join Sarah in welcoming you to this webinar, given this important topic at this point in our education. You will be hearing shortly from three of our superintendents who are superintendents in residence. This is a unique program for us, as we are one of very few institutions nationally that have superintendents embedded in our college to assist us in developing a more collaborative engagement with our community and our school districts, particularly in the state of Ohio. So I thank you all for joining us in this enterprise, and I hope you will find this informative as we here at the College of Education and Human Ecology attempt to address some of the difficult questions and challenges in this current environment. I will now introduce the moderator of the panel to you as part of this enterprise this afternoon. I have the pleasure of introducing to you Dr. Antoinette Miranda, who is a professor in school psychology here in EHE. She is currently the interim chair of the Department of Teaching and Learning. She has also published a great number of articles that are focused on cultural competency, racial identity, consultation, and service in urban settings. She is also a member of the Board of Education for the state of Ohio. Dr. Miranda.
Thank you, Don. These are really unprecedented times, and so it is very exciting for me to be able to moderate this wonderful panel. So it gives me great pleasure to introduce the three superintendents in residence. We'll start with Dr. John Marchhausen, the superintendent of Hilliard City Schools, Dr. Marie Ward, superintendent of Fairfield County Educational Service Center, and Dr. Talisa Dixon, superintendent of Columbus City Schools. Welcome. All right, so we're going to get started with some questions, and each of you can take a turn answering it. The first one is, how have your partnerships with the College of EHE as the inaugural superintendents in residence helped inform some of the work you have done to prepare a completely different type of learning than schools are accustomed to? And I don't know if John, you want to start, and then we can go to Marie and let Dr. Dixon take up the end.
Sure. First of all, thank you to you, Dr. Miranda, Dr. Pope Davis, and everyone at Ohio State for making this possible today. From the very start, we have engaged as superintendents in residence with the team at Ohio State. Early on in March and April, I asked Dr. Pope Davis if there was an opportunity for us to submit plans and ideas to the Ohio State education faculty for review and recommendations. We are truly, as we've said over and over, in unprecedented times. And as we look at remote learning, as we look at the social emotional toll that isolation is taking on our students, as we look at how we prepare teachers for something that, quite frankly, most of them were not trained for. And in the spring, when we did remote learning, we called it e-learning, and that E quickly became emergency learning. As we put systems together quickly to do the best that we could. But now, as we prepare for the potential of remote learning again in the fall, we've got to be better than we were in the past. So the team at Ohio State has actually reviewed and sent back comments and resources to our Hilliard team, that our team is then able to dive into those resources. The wealth of knowledge in different departments within the college has allowed us to be better at what we do. From distance learning to counseling to different ways we assess emerging readers and how we're going to prepare to teach kindergartners and first graders to read via Zoom and using iPads and Canvas. It's a whole nother challenge. So the team has been there for us, and I am so thankful. And I know that others in our Columbus area have also taken advantage of this as well.
Thank you. Marie?
Well, I'd like to just echo John's sentiments. Thank you very much to the college for engaging us in the work that we've done in the past year, and I very much look forward to this coming year. To sort of build on what John shared, I would say the other area that's really assisted us as an ESC in terms of the work with the college has been a focus on ensuring that we address equity in terms of how we are serving children, that there's access, that there is equal access, and that we are planful and focused and thoughtful about how we ensure that every child has access to a high quality education in this very difficult time where we're potentially hybrid, we're potentially remote, and a situation that's very fluid. The other is really helping us to be better equipped to address the social emotional needs of children during this time. Academics is clearly important, but if we don't have children who are stable, who we are addressing issues of trauma regarding what's happening in their homes or in their communities with this situation, we're not going to get to the academics. So we value the relationship we have with Ohio State.
Thank you. Talisa.
Yeah, I think that my colleagues have said it all. But again, thank you for this opportunity. And I think the only thing I would like to add is that this partnership has provided another set of thought partners for us as leaders, right? So, you know, prior to COVID, I think many organizations worked in silos, right? But since we are already partners with the university, it allowed us to have a broader reach automatically and be able to send an email and pick up the phone and say, help me think through these issues of equity, of SEL, of all of those things because the relationship is already established. So I appreciate that we have, you know, the largest university in Ohio to be able to be thought partners to our school districts. And it really, for me as a leader, it took a little of that weight off of me during these unprecedented times to know that not only I have Marie and John, but I have, you know, Dr. Pope Davis and yourself and others to lean on as a thought partner to help navigate through some of the same issues as Marie and John spoke to.
Yeah, thank you. In your discussion, you've already sort of alluded to some of this. How are districts addressing the needs of vulnerable students? And specifically, how will the needs of students that are on IEPs, 504, and other learning plans being met within the safety guidelines of COVID-19? I'll let anybody start on that one.
I guess I'll start. I'm with an educational service center, and we primarily serve children with disabilities. So we work with 8 client districts in our county. We provide the preschool, early childhood special ed services to Pickerington and to all of the small districts outside of Lancaster City Schools. I would say that you have to start with individualized. You know, we have individualized education plans, and we have started with really trying to assess what are the needs of our children. Space is a huge challenge. So we primarily serve littles, our 3 and 4-year-olds. They are not masters at social distancing. They're not great at staying in their bubbles. So we did make the decision in collaboration with our districts, our client districts, that at least for the first 9 weeks, we are not going to have typical peers, because our primary focus is on ensuring that we can close the learning gaps of those children. That was not going to be able to be accomplished with the amount of space that we have. And the other is that we've had to develop multiple plans, regardless of whether we're doing preschool all the way through 12th grade, relative to the status of the building in which that child's being served. So I have 8 districts. I have multiple buildings within each district, and there are multiple plans across the county. So we are trying to work collaboratively to not only address the individual needs of children, but to also be responsible and respectful of individuals' decisions being made by districts. One thing I will say that we did that we hope will help to address the needs of children who have not responded well in a remote environment. So those kiddos that we have, that telemed was not effective in addressing those needs. We were proactive in working with our local health department. We have submitted a plan to them for a review and approval that enables us to use almost a clinical model to bring kiddos in and to work with them in smaller groups and in one-on-one settings to provide the related services and targeted intervention services that they need. We also have been able to work with our districts. So regardless of whether or not a district is hybrid and bringing in one group half day and or half the week, the other group the other half, or a week on, week off, for our students with disabilities, our goal is to bring them in up to 4 days a week so that we can continue to intervene with them to the maximum extent possible.
So for Columbus, we've been very thoughtful about this group of students. We have over 6,000 students who we consider vulnerable youth, and those are students that live in a foster care or homeless shelter. In addition, we're looking at least 1,200 students, K-12, that have specific IEP needs. And we are being very thoughtful and still planning on how do we address the needs of those students in a remote setting. And is that possible? Is it even realistic? And if it's not, how can we make the accommodations to make sure, it goes back to something Marie said earlier, equity. How do we make sure that those students have what they need during these times? So for Columbus City Schools, we're still planning. We're still working with other leaders and our partners and our parents, because a lot of parents are reaching out to us for assistance, and we're trying to make sure that we can do it in the safest way possible. And I think that's important. It's not that we don't want to be with our children, but we know that those students need specific needs, and many of them need hands-on assistance, and we have to make sure that we are able to provide that in the safest way as possible. So we're still planning, we're still working with our health officials and other experts who are guiding us to make sure that we have the best plan to move forward for our students. We don't want them to have a gap in learning. We want to assist them. We want their parents to be able to have some additional support as well for at-home learning. So the plan for Columbus City Schools is still in the works.
Well, for us in the spring, as I said before, the spring was really about access. Could we get our students all connected, and could we get them access to the services? For our students with special needs in the fall, now we switch to instruction into therapy. We'll be able to provide 100% access to the internet to students in the Hilliard City Schools. And we're a one-to-one district with iPads in grades pre-K through 12. So we've got the access part. Now it gets to be the instruction. And how do we provide those personalized individual services to each of those children? Our health director in Franklin County this week gave us permission that even if we are in remote learning, to bring in groups of students of 9 plus a teacher. So up to 10 people in a space, which meets the health requirements, of course, with masks and with social distancing. And if we are in remote learning for a prolonged period of time, we will be working on schedules whereby we can pick up the students who have needs, bring them in for specific services, get them home for other services. And not only does that allow us to meet the individual needs of students, and some of these services can be provided remotely, and some of these students can't be provided remotely. It also allows us to keep our bus drivers and our custodians and those groups as we do what we need to do in schools. And I think the three of us and all of our colleagues want to get our kids back to school as soon as possible, but it's got to be safe. And if we can do that in a safe manner in smaller groups to meet the personalized needs of our most at-risk learners, that's what we're going to try to do. As I say to our community all the time, Dr. Miranda, what it's going to take is we all have to give each other a little grace. We're doing this and learning together, and what we try at first may not work, but we're all committed to getting it to the best and highest levels possible as quickly as possible. But we're all working really hard to meet the needs of our kids.
Yeah, in the same vein, how are you addressing the social emotional needs of students and faculty dealing with the stress induced by COVID-19? I know that social emotional learning is a huge piece. And then just some of the students that are kind of feeling isolated. How are you guys, in your districts, you addressing that?
Yeah, for us, you know, when we think about, many of us haven't seen our students since March, right?
Mm-hmm.
And for Columbus, we had this robust summer school plan for our students to have these summer passports, and we were looking so forward to that. But we quickly saw that we had to move away from that and go to an online summer program. So we understand that our students are dealing with this in a very, and in many cases, in a difficult way. You know, when I think about, again, those 6,000 plus vulnerable students. And so we want to make sure that we have a platform for them. So we're making sure our social workers, our psychologists, and other ancillary staff have some additional training to support our students this fall. We, unlike John and Hilliard, we were not a one-to-one district. So COVID taught us a lesson. One, we had to flip to an online platform very quickly. And two, how do we make sure we get the devices in students' hands? And third, how do we make sure teachers get the tools they need to teach in this platform? So now when we think about students coming with social and emotional learning needs, how do we make sure that we can provide supports through them through this medium, just like we're having this discussion now, and we need to be able to do that for our students. So I had a parent that called me and said, Dr. Dixon, I just want you to know that my daughter had her first session with the social worker via Zoom. She said it was so difficult for me to hear it because her daughter was just talking, just, you know, and excited, but she was sharing and mom is in the background. Where prior in an in-school session, mom didn't hear what the daughter was disclosing or that conversation. So we're going to continue with that. We're going to continue to provide the supports for our adults to help our students, and we're going to utilize technology to leverage that. So whatever mediums that students need, the supports that our staff needs, we're going to provide that. Even if it's small cluster groups, I think now adults are going to have to live in a student's technology world, for example, you know, they are safe in that space because they use technology all the time. So now we have an opportunity to leverage lessons, connecting with students and families, just one click or one Zoom or one WebEx or one Google Meets away. And I think as we get better at that, we're going to find that that is going to be a pretty cool, effective way to even build upon and connecting with students.
Thank you.
And one of the things that's going to be very different for us in the fall than we had last spring is we have a synchronous schedule for all of our elementary, middle, and high school students. And just like that morning meeting time was so important for our elementary students, to talk about the issues and their feelings with their teachers, we have morning meetings now built in a synchronous way for all of our grade levels. Even at the high school level now, we will run for a 4-hour period, an 8-period day with 25-minute classes, where students will be face-to-face with their teachers in Zoom for 25 minutes a day, and they'll run through their schedule. We learned quickly by just having office hours with that kind of unstructured, it was very difficult for students and teachers to get all on the same page. So when we're in what we're calling in Hilliard e-learning 2.0, 2.0 is synchronous, and that will allow for those conversations. And when we look at social emotional, and Talisa brought it up, we've got kids coming back to school who may not have talked about the events of our world since the tragedy of George Floyd. We have kids who may not have an outlet for their fears about the social challenges, the cultural, the racial, fear of COVID. We have changed our calendar to have 5 days of PD. And I know Dr. Dixon has gone to more than that with her staff. We got to get our staff ready to have these conversations. And it doesn't matter the grade level or the subject. If a kid in one of those morning meetings wants to talk about what it's like to be Black in Hilliard and what they felt this summer, we got to be ready. And that piece of social emotional, that real conversation about our world today is going to be so huge. And if we're in remote, we still have to be ready, and we got to be ready to roll.
Yes, thank you.
So in Fairfield County, we found in the spring that implementing about probably 2 or 3 weeks into the spring, and it depended on the district that we were working in, but there was a day that was designated for SEL activities. So the teacher and the therapist, the music therapists we have on staff were leading children through activities to sort of process information and to help them. We're also a PACS county, so we have PACS implemented in all of our special ed classrooms, including preschool, in our Learning Steps preschool. And so our staff are all trained in PACS. What we did find is that our parents are not highly skilled at creating structured environments for their children to learn at home, nor do they have some of the parenting tools necessary to help manage children's behavior. And so we started with some of our teachers actually virtually helping to de-escalate children who were not keen on learning remotely. But what that led this summer was for us to be able to leverage some funding through our local mental health board, and our BCBA will be trained as in the PACS tools, and will actually be working to bridge that to homes and helping parents to acquire those tools to help their children. We have continued with mental health services that'll be provided remote, music therapy that's provided remote or in person. And regarding our staff, I think the other piece that we've invested in is our employee assistance program and some of the self-care training for our employees to feel like they're prepared to come back. Finally, lots of professional development. We have offerings in trauma-informed care, the trauma-informed classroom. All learning is SEL. And we also have created hangouts for both parents and or caregivers, because sometimes it's not the parent, but it's grandma or somebody else who's caring for that child, where they can come and hang out and get advice and support in trying to support their child's learning. So those are some of the things that we've done.
Can I add something to this? One of the things the college has been able to do is even help us when we're talking about social emotional learning with an equity piece, right? Because we know there is, for lack of a better analogy, it's not going to be a place for us to hide from difficult conversations of what our students are going to face. Whatever those conversations are, they're going to be front and center on Zoom, right? So we have to be able to have the skills to talk about that or be open to listen to that. So we thank the college for being able to help us with that training. So that's something that's important for us to do, how to even train our teachers to be better listeners, right? Or to react or to get the resources. So things that they may have had additional support to do, right? A student comes to the classroom, they may be depressed, well, I can send them to their guidance counselor, right? Now we want to be able to equip our teachers to have a process in their own virtual world, right? To be able to help. So as John said, they built it in the schedule, right? So you have that time in the morning to debrief, to, you know, unpack whatever was on your mind the day before. And teachers are so smart and clever. They know how to do that well, and they're learning how to do that well. And then you may be able to integrate that into some type of project, right? How do we learn empathy, right? You know, how do we become more kind to our students and listening? So I think that everyone knows that the world has been shaken and that we have to approach everything in a different manner, and that we are learning. But as John said earlier too, we have to have some grace. You know, we don't have all this stuff figured out. We're learning together. And I think that's the power of this whole collective responsibility. The entire community must wrap itself around our students, our school districts, to be and our families, to be able to come to some solutions that are good for all.
I would say that in this environment where we started using Google Hangouts and Zoom among staff as well, we have seen staff engage with each other at a higher level than they have ever engaged. You know, as Talisa alluded to earlier about people operating in silos, that same thing happened within our systems where people operated in silos. And it's awesome to see. I hope that continues long past when we're back in session.
We're having our teachers report in remote learning. Our counselors will be in the buildings with their teachers. And I know there are a lot of questions about PD. Our teachers will be synchronously engaged with their students for 4 hours of a day, but we're having them report for their work day. So that gives us time for engagement. It gives us time. So if the social studies teacher has a concern with the behavior of a student in his or her class, the guidance counselor's in the building, so they can go with a mask on and maintaining distance and say, hey, I got concerns about this student. Can you help me out? What should I do? Can you call them? So I think by creating the collaborative environment with our teachers in remote learning, by saying you're a professional, this is your space. And our health director has said it is perfectly safe for teachers to come into schools that are free from students, because they have a 900 square foot classroom that they can be in, and we can do data teams, we can do SEL work, we can do engagement. So the professional learning and the lifelong learning is something that we have more time to be able to dive into with the team.
As a school psychologist, I am just excited about the innovative ways that you've included SEL, because it's just so incredibly critical. So it's exciting about the things you're doing. And I agree with you. I hope it continues after COVID-19 and we take the lessons that we've learned. One of the other things that's been coming up, you've sort of alluded to that is of interest, is some of you talked about this. How did you get, and I guess this is particularly for Talisa, because John is one-to-one. How did you get the iPads, the Chromebooks out to your students? And what about the bandwidth and Wi-Fi? And Marie, I know you have some rural communities. So this is always an issue that people have worried about. And so I'm wondering how you guys have dealt with that.
Well, yes. So again, Columbus was not a one-to-one district. And we found ourselves loaning out 19,000 computers to our families. And we initially gave out 13,000, and then families were emailing us and saying, hey, I have 3 kids at home or 4 kids, and they're sharing these computers. So it was a lesson for us thinking about the future, right? So I needed to push the district forward faster, and it allowed me to say, hey, we got to think about the future and how we need our students to use technology as a lever. And because of these unfortunate circumstances, we are here now. So what do we do next? So I reached out to our partners. You know, I just completed my first year in Columbus. And one of the things I said to my partners, when I come with an ask, I will be very intentional about what that is. So my ask didn't come until of late. My first ask was hotspots. We learned that because we were giving devices, we made an assumption that people had access to Wi-Fi. And we learned quickly, oh my gosh, that is not the case. We're in a city, Columbus. Everybody should have Wi-Fi, should be like a public utility. So we learned quickly, a partner provided those for us. The second thing is, how do now I make sure that students have these devices? So I reached out to the city. I had a conversation with the mayor, and he met and said, hey, Mayor Ginther, we need this. What can you do to help provide this? And they've given us a little over $7 million, and we're buying 20,000 Chromebooks for our students, and they will have those for the beginning of the school year. And I was also reaching out to John. I said, John, he's been one-to-one for quite some time. And I'm saying, what are you doing? How did you get there? What platforms are you using? And that helps. Again, this relationship, we met through this, you know, through the superintendents-in-residency, and we just bounce so many things off of one another, and that has helped us. You know, we wanted to remove every barrier for our students in Columbus City Schools, that their demographics may be totally different from my colleagues, but we didn't want not having a device and not having access to Wi-Fi to be the barrier that they could not continue their learning in this online platform. So we're still not one-to-one, but every student will have a computer, access to a computer this fall. And we're going to work with other partners so that by 2023, every single student will have his or her own computer. They will have access to one this fall, but we want them to have their own computer by 2023.
Thank you.
So I have 8 districts. All of our districts were in some stage of one-to-one. For some of them, it was just high school, and for others, it was all the way through. We have one district that's probably our wealthier district that they allowed kids to bring their own device to school, so they didn't provide it, but they closed the gap on the kiddos who needed a device. So the hotspots were an issue. And that was solved in a number of different ways. For some, it was putting hotspots on buses and going and parking them somewhere. For others, it was collaborations with churches and the community where parents could pull up in the parking lot and they weren't impeding a business. They weren't causing issues, you know, in other public spaces in the community, but the churches were working with that community to provide the hotspots. One thing that we forget about with some of our families is it's not that there isn't internet access in their area. If they've not paid their bill, even if you're going to allow them free access, that carrier may not allow them to have an account because they have a past due account. And so resolving some of those issues became work that we did not anticipate. At the end of the spring, we ended up in a place where there were very few children who had no access to a computer or the internet. The next stage of the issue or the problem is some kids are tough on devices. And so the next stage of this is repairing and replacing and ensuring that those devices are in working order and making sure that there's a system in place in every one of those districts. And so I think our districts have all in their own way and in collaboration with the ESC done a fairly good job of meeting that need. It's the continuity of that work that's going to be really important in terms of resources.
Yeah.
And we're about 25% free and reduced lunch in Hilliard. And one of the things that we've done, to Marie's point, is we have an account with Spectrum, which is an internet provider for our district, where we buy the account and we pay the monthly bill, and then Spectrum goes and hooks it up for the parents. So the parents who can't do the credit check, who have the bad credit, who have the past due, we can make sure that for a 9-month period they're connected. We also have the same thing with the Verizon hotspots. The district owns them. The district turns them on. Verizon has been fabulous in allowing us to put them in summer mode, so we don't get charged. Like, we may sign a 12-month contract, but it's not 12 straight months. If we put them in summer mode, okay, that's 3 months. You still have 9 left, but we've been putting ourselves in those positions for our most at-risk families. And we've been very fortunate. Over 7 years, we didn't become one-to-one overnight. Started with the technology task force in my first year. Started with 6th grade, then added 7th and 8th, then added K-5. So we have built this capacity over a number of years, partially by saying we don't buy textbooks anymore, that we curate and build our own resources and we put them in Canvas. And so we've been very fortunate that the work we did pre-COVID paid dividends when we got to this point, because we were well positioned, and that helps. But we also share resources. Right now we are building our own K-6 curriculum in partnership with the Lakota City schools, where we have teams of 8 Hilliard teachers and 8 Lakota teachers building a 1st grade online curriculum for our digital academies. I know Marie and the ESCs are part of a network that are working together, and the ESCs help districts that can come together and provide those resources. We got to work together here, and it's been a benefit of this is some of the collaboration.
Yeah. Okay. How are you communicating with staff, students, and parents to keep them informed as district planning unfolds? And then kind of coupled with that, how are you collaborating with local health officials to collect and disseminate information to families about how to stay physically and emotionally healthy? Because I think also as you try to keep parents informed, the local health officials are also influencing the decisions you make.
I'll go first this time. We meet with Joe Mazzola and Dr. Roberts, who's the Columbus Public Health Commissioner, once a week as superintendents. It's a scheduled Zoom that we have the opportunity once a week for about an hour and a half now to engage with the public health officials. They have both said that they're not putting deadlines on when we can go back face to face, that we're gonna get through this together. The health commissioners have also been making their rounds at board meetings. I know when Dr. Dixon made her announcement, Dr. Roberts was standing there right with her in that school and part of the announcement. So I don't think now is the time you want to separate from those folks. You want, you can't be arm in arm because of COVID, but you want them standing next to you as you make these announcements. In Hilliard, we do weekly Zooms with both our staff and our community. I'll tell you, it was a little unnerving when I was doing the first community Zoom and my account topped off at 500. And I found out that if you give Zoom money, they'll increase it on the fly. I had to increase it to 1,000, then I had to increase it to 3,000, then I had to increase it to 5,000, because we had like 3,500 community members on the first Zoom that we had. And when you're talking like this, you forget that there are 3,000 people listening, because you're just looking at like, hey, I'm looking at Dr. Miranda. This is cool. We have tomorrow night, we have a special education Zoom. that I'll introduce our Director of Student Services. We'll have 1,500 people on that Zoom. So you can do it that way. We still do our school messenger, and we push text messages, and we do phone calls, and we do emails and social media. You can't expect people to come to you. You have to meet them where they are. So I'll pass it over to Marie now for what they're doing in Fairfield County.
So I would say we were sort of fortunate. So the Friday before schools were shut down, I had ironically planned a superintendent's meeting, and we had the health department coming to the meeting. And so that was wonderful timing. We have continued that communication. I feel like I actually talk to the health department on almost a daily basis, and they're on our weekly calls. They have been very instrumental in helping us acquire some of the PPE that we need. And the ESC has served as a hub for the distribution for some of that equipment or supplies that we have. Of course, we have districts that we serve all over the county. So for us, creating some Google files where information that's current in terms of all of the district's current plans and updated plans, which has been changing regularly, their calendars have been updated. Those are all dropped into a shared folder so that people can access it and update in real time. Of course, we have our newsletters and all of the other things that we do with staff, but the Google Hangouts and the Zoom calls have been instrumental in terms of helping to feel like we have engaged all of our staff. But at the end of the day, when it comes to the parents, I think that they appreciate the emails and they appreciate messages in writing. But if we can have staff pick up the phone and give a call and have a conversation with a parent about the concerns regarding their child, it goes an awful long way in terms of building trust and letting them know that we truly are committed to ensuring that their child is going to be safe and that we want to serve them well.
Yes, for us, last year I established a chief of engagement position. And I did that primarily because my first 100 days, so many people were saying that we were not listening to parents and partners, and although we had an office of communication. So I never thought that we would have to use that office in the way that we've been able to this year. That engagement strategy and that team has really been the almost a safe haven for us reaching out to partners in a very coordinated manner. We were able to get partners to meet the families' needs. We sent surveys to families to see what they needed, and those partners were able to respond to those families' needs. So we've been able to continue that engagement strategy by having virtual Zoom meetings on various topics. So you can go online, figure out what topic you want to listen to, hear more about, and we have a team there each night. Last night, we had our English language learners, and we had Spanish interpreters. So the entire session was done in Spanish. And these sessions are recorded, so families can go back and they can review those at any time. For our staff, I think this was for me as a superintendent, this was the hardest piece. How do you keep hope and provide hope for your staff during uncertain times? How do you keep the momentum going? How do you ensure for us, the entire organization, that things are going to be okay? When you as a leader are not sure, you're learning information, things are changing every day, but still you have to be able to give hope to your organization. So I was able to do that through letters. I did some video recordings. And it was some recordings I had to stop and just kind of just say, stop taping, because I got emotional as I'm trying to make sure that they're hopeful. Because when you think about the context, you know, there are only 600 school districts in Ohio. So there's 600 of us that are left to make these big decisions about our communities and our students and our families. And so the way we message that and message that with strength and confidence and to reassure them that we're going to get through this, it was tough, but we did it and we're still doing it. I've not gotten to the Zoom meetings like John. I did a few with students on a weekly basis, and oh my gosh, those were powerful, just kind of listening to our students. So I got to get to more of that for us doing the live meetings. But when I think about working with the health department, my first major decision was moving graduation to all online. That was tough. But for Columbus, when we looked at the data and what was happening with this virus in the zip codes of this district that I serve, we saw numbers that were very different from my colleagues. So when I made the decision or recommendation with the recommendation of our health officials to say our graduations had to be virtual, I had a lot of families and students who were very upset with their superintendent because they saw celebrations happening with their friends in other school districts. And that was tough. You know, when you think about equity and why is this virus at that time, why was it happening in certain locations and zip codes and not others? How do you explain that to students and family who wants to celebrate, and many times the first high school graduate? You know, so, you know, that was difficult, but I made sure that I allowed the science and what our health officials shared with me to make that decision. But I learned from that for the second decision. So when we decided to go virtual, I asked the mayor to stand with me. I asked the commissioner to stand with me. And I asked the city council president, along with my board president, to stand with me. I wanted families to know that this is not a K-12 decision in isolation. You know, decisions we're making around COVID-19 are health decisions. And those are not, we are not medical doctors, right? You know, these decisions are outside of our expertise, but we're working with other experts to make the decisions that's best for our community. So for us, for Columbus City Schools, is direct relationships and conversations ongoing with Dr. Mashika Roberts and her team, and making sure that the decisions we make are related to the zip codes of the students that we serve, and knowing that if we have to do something different than what my colleagues are doing, it's okay. Because what's happening in my district for my students and families where they live is very different from others, and I have to ensure that they are safe from this deadly virus and not put them at harm in any way.
Well said.
Some of the things you've talked about in terms of looking at partnering with EHE, and some of these have come up. Some of the things have come up is using, for example, people that are going to be student teaching, looking at school psychologists in training, counselors in training, that might be able to do some support groups. And so that's been kind of floating around. And so I guess what I would ask you, how can EHE continue to best support maybe utilizing our students that may want some of these experiences? And I know that was one of the questions that people have been asking and has come up several times.
Marie, you want to go first?
Sure. I think that there could absolutely be opportunities. To be honest, I think some of our young people could teach us a thing or two. They are the natives of technology.
Yep.
I'm a little bit older. So I do think there are a lot of learning opportunities that could go in both directions. And I think there's now some flexibility in that we are remote that students who otherwise weren't able to come down and get experiences in a rural environment might now have the opportunity to engage with children in communities they wouldn't otherwise have had the opportunity to engage with. And then hopefully when we open back up, we can physically have them come down to be able to continue that relationship. So I think there's value in it.
Mm-hmm.
We've talked with Dr. Mary Peters at EHE about having some of our junior and senior students at the university go through our ESE training to become paraprofessionals.
Mm-hmm.
And if a lot of those students in a lot of Ohio State's classes are now shifting to online, and depending on how many of those are synchronous or asynchronous in a student schedule, we could potentially have third or fourth year students who get paid to work in our buildings, who could get paid to help us with our reading assessments, with some of those other assessments that a paraprofessional can be trained to administer. And the other thing is, what if we remain in remote learning for a longer period of time? How great if you could have college students who want to be teachers as part of those breakout rooms, as part of those conversations. Our teachers have become pretty adept at the breakout rooms in Zoom and giving instruction and breaking the kids out in the rooms and popping in and out. To have a third or fourth year Ohio State education student who is either volunteering or getting paid to be in those spaces. And my only word of caution for those students is don't pretend to know more than you do.
Mm-hmm.
It's okay to say, I need help. And no one expects you to be the expert. Just if you need help, get with the teacher. But those students could be invaluable as we look at, and some of the questions in the question and answer. How are you going to catch up on some of the assessments? How are you going to do some of these things? We still struggle with kindergarten screening. We still use F&P as part of that kindergarten screening process. We can train people to do some of this work.
Right.
So we'll take all the help we can get.
I think the other is data collection, so that they're in that Zoom at the same time the teacher is, and collecting data on children's responses so the teacher can focus on the teaching.
Yeah.
And
I think one of the things I challenge my team with is that if we come back to this space with the same thinking prior to COVID, then we are not being innovative. So now how can we co-design something very different, utilize people in a very different way, and get away from desk and rows? You know, you see all those old videos about schools, and then one thing they have in common, that there are desks, there are rows, and there's a teacher in the front near a chalkboard. Those days are over. Mm-hmm. So now how can we, you know, co-design something very different for people who want to work in our space in a very different way? And so I look forward to the opportunity to just kind of co-designing it and just coming up to see, hey, what can you do? What I do? For example, even when we were looking for transportation for our families to get to our meal sites, you know, the CEO of CODA, she called me and said, Talisa, what do you need? I said, hey, I need people to get to the food sites. Done, right? They're thinking outside the box, wanting to help. We are. So I think this is an opportunity to reimagine education space, and we should be forward thinking. We should be partnering with our colleges like we are, and really thinking that when this deadly, ugly virus is over, our schools are going to look so different because we have been thoughtful in thinking about how do we utilize people with other expertise, get outside of that box, and go in and reimagine our schools. So I am excited about the potential of that, and look forward to those who want to work in our space and do it very differently, because now we know it's going to be remote, right? So how can we utilize those experts? And so if you want to join any of our districts, yeah, come and talk with us, talk with the colleges. We're excited to have you help us leverage our K-12 spaces using technology.
I think the other area in which transformation has occurred because of this opportunity of COVID is in the area of professional development. Our team very quickly was able to take many of our face-to-face trainings, move that into a virtual format. We had been planning a face-to-face PBL, Project-Based Learning Institute, for the last week in July, so it was a week ago, and thought, wow, are we going to have to scrap this for this year? Started working with our partners at PBL Works, and last week had 7 sessions filled with 248 participants, including 25 states and 7 countries. So talk about the power of the network there and the experience that those folks had engaging with each other. And our training with Google, our training with SEL, it has been amazing, the richness of the conversations. The other thing that I would say has been an unintended, a positive outcome of Zoom and remote learning and professional development. And I saw this in the course that I was teaching in the spring for Ohio State, is that in class, you know, you have these children who are the vocal ones. They'll speak up, they contribute, their hands up, they're mouthy, they, you know, they're all in it. And you have the kiddos and you have those adult learners who are, they sit back, they're quiet, etc. When we moved to a virtual format, we saw a higher degree of participation across students than we had in a face-to-face setting. So there might be some value in blending that and using that as an opportunity as we continue to move forward for both students and for adult learners to engage in a different way.
You know, Talisa talks about one of the ways things change and they're not going to come back. Our partnership in large part with Columbus State Community College, but now also with Ohio State around College Credit Plus. As we've shifted some of our higher performing high school students to remote, the concern about AP classes is pretty real. And in a district that had a high number of high school students who took AP, lots of questions with that. But Columbus State and Ohio State have really stepped up. Last year, we awarded 4,800 college credits. We're going to double that this year if everybody sticks with what they're doing. And I can tell you, I'm not sure AP will survive some of the things that we're seeing right now, because why would you take a high school course that you have to take a test to potentially get a 3, 4, or 5 on that may transfer to your college, when if you're planning on going to school in Ohio, the articulation agreements are there, you're guaranteed the college credit transcripted from those colleges. And I had the good fortune to talk with Randy Smith last week about College Credit Plus at Ohio State and what Ohio State's looking to do in that area. It's a change that's not coming back. And we're going to see some of those changes that move us from the better. And as a pastor's kid, I always say the 2 things that are too slow to change are churches and schools. And this is kind of forcing both of them to, who would have thought my 78-year-old dad would be doing Zoom church services at interim pastor, but there he is on Sunday morning. And I get to watch him again. So we're all learning and adapting as part of this crisis.
You know, if I can go back to something Maurice stated, I think it's pretty powerful. You know, the amount of engagement that we had prior to COVID. In our school district, we have a lot of students who, you know, we think about the dropout rates, the students who don't come to school. And we always ask ourselves, well, why are kids coming to school? And many times we found they are not engaged. There's no connection. They've not found a trusted adult that they connect with, right? To your point, this is an opportunity to connect with someone and you don't have to see them in person, physical. right? So whatever those issues for the student or the adult, this is a way to reach out. And I believe that we can leverage this opportunity to get students engaged behind the camera, for example, right? You don't have to be in that classroom. And how do we give teachers the tools to engage in students? And so we can get rid of some of these myths, especially that plague us as an urban school district. And that is about Black and brown kids, students who live in poverty, those expectations or those beliefs that we have, those biases that we have that somehow present themselves in a very different way when you're face to face with this student, that may be different when you're behind a camera, right? Or you're behind the monitor. So for us, we are having to face those and still have those difficult conversations. And they stem from a lot from the beliefs and the expectations about our students and their families, about their potential. And hopefully this get us the opportunity to get rid of that. When you think about, as John stated, AP, we know some students have access to AP and some don't. And sometimes that access is that trusted adult saying to you, Talisa, I have faith. I believe that you can do well with more rigor. So I'm going to make sure you have access to this course, and not present systems that students don't even believe that they can walk through the door of an advanced placement course or an honors course. So I think it will give us in the K-12 space an opportunity to look at how well students are still have access to rigor, how well that they're doing in this platform, and really, maybe it's a research topic for for OSU, to really look through this and see, to your points, the level of engagement and how well students are performing when they're not in the physical presence of a student and their peers, when it comes to access and performing in classes that are more rigorous.
I think there are going to be a lot of dissertation topics around COVID-19, I have a feeling. One question that has come up is thinking again about special ed, getting kids that are in special ed, getting reevaluated every 3 years, kids that are going to be referred to special ed. How are your special ed departments? I know, John, you said you're going to be meeting with your special ed coordinator, and this is challenging because most of those tests are done in person. How are we beginning to deal with referrals or having to assess them every 3 years? Because as we know, that's a federal mandate. And so no school wants to be out of compliance. So any thoughts of where you guys are going with that?
So I'll go first. So we, as I had mentioned earlier, we actually thought this through fairly early on and submitted a plan to the health department that was approved. So at our ESC, we have the ability to have a separate entrance where parents can drive up. We have been able to obtain face shields, a mask, everything that you need. We have an entire system for the parents' schedule. They come in, they text us or call us to let us know we're there. We escort the child in. We help them to become comfortable, and we're able to do the face-to-face testing that's required. So we have continued with that. We just submitted a request to expand that plan to K-12. And so now that is being conducted in local districts as they're ready to begin to bring kids in. So to the extent to which it can be done remote in terms of collecting the surveys or questionnaires from parents, conducting some of the observational information, that can be done remote. And for that needs to be done face-to-face. We're doing it.
Awesome.
We're doing it. It's going well.
I think part of it's going to depend for us in Hilliard on how long we anticipate being in remote learning. If we get the okay from the health commissioner and Franklin County goes to orange, we're going to try to get into hybrid as soon as possible. We've got a solid hybrid model that we believe we can work in. If remote learning looks like it's longer than the first couple weeks, then we're going to have to bring those students in small groups. We're going to have to start finding opportunities to create those 4 and 5 or 1 with the assessor opportunities for kids to come in and get those assessments. We can't say we're going to wait until November. The other thing, and Talisa and I were on a call with the governor this week where he kind of predicted this is going to get worse in November, December, January. So one of our goals, and Ohio State pushed its schedule up with the anticipation that things could get worse after Thanksgiving. I think all of us would be well served to not put off those mandatory assessments and to start getting after them as soon as we can, because if the experts and the folks who predict where this is going to go and model where this is going to go are correct, we don't want to find ourselves in November and December facing being out of compliance. So we're going to have to jump pretty quick on this.
Great, thank you. Okay, Talisa, do you want to add anything?
Well, no, just that for Columbus, we've already decided to start off remote for the first 9 weeks. So we are still working on a plan for our special needs students. So more information is coming regarding that student body. Okay,
thank you. Well, we're hitting the 4:40 and we want to have opportunity to answer some questions that have been coming from the audience, but one of them that's come up a lot is really trying to find out how can the community, a lot of people in the community are saying, how can we help? What can we do? Do you have any thoughts about how we can engage the community in a number of different ways to help during this time?
For Columbus City Schools, I think it will be to help us with parents when it comes to childcare and resources, right? So when we made the decision, we wrestled with, wow, there's a message, a sort of mixed message, right? We're saying that kids should be safe, yet we want parents to go to work. And how do we make sure that we have a compelling message, like it's not safe to go to school? And what do we do with our students when they're home, and who's going to be at home assisting them with their lessons? And so we recognize that parents are saying, hey, we're not the experts. You guys are the experts. You should be doing this. So if we can have our partners through us, so we're working with we have a strategic a strategy that's pairing partners with our parents and our families. But I think that's where it's going to come. How do we provide tutoring or little fall or spring camps or all of those additional supports to help our students stay engaged in the learning during the school day? We are committed to providing the resources to our partners. So we're implementing new curriculum this fall. We're going to have make sure our partners have access to all of that rich curriculum online, so that when they're having these tutoring sessions or camps, they have our resources to be able to provide to their students, so there's no gap. And they're not having to find resources to implement in these environments too. So that is one. And if you know of psychologists and school nurses, nurses and all of those in those fields who want to volunteer somehow in a way to have Zoom sessions with our students and families. Families are dealing with a lot. And there's a lot of heavy lift. There's some support. I know sometimes they just want someone to talk to, just give some strategies as a former parent of how to help students, establish study schedules, how to make sure that they're on task. I think that is something we want the community. We are working with partners, larger partners, to make sure students have a device. We're working with partners to make sure they have headsets parents said, hey, you're giving them this device, but please provide a headset. We don't want to hear all of those Zoom meetings and hotspots. But I think if we have partners who want to support our families, that will be awesome to make sure that they have what they need to get through these times.
Yeah.
To add to that, I would say the other thing, Talisa, that we found in addition to all of that, and we had a day-long day of training and engagement with our staff, is the materials and supplies for children to do some of the assignments. I know in Columbus there are big backpack drives and whatnot, but one of the things that our teacher said is they're currently crafting, so what would a preschool backpack need to include? How about elementary? How about junior high, high school, so that children have the resources and the tools necessary to do some of the work? We think that that's not a big deal, but for a lot of our families who are struggling to put food on the table, that is a much larger lift than we recognize.
Yeah.
And so that kids have the same materials. So there's equity there in terms of what resources they have to work with.
Yeah. One of the questions that has come up is, how are you handling kindergarten?
I'll let John take that one.
Well, I'll just say we met today. If we start the first 2 weeks in remote, our kindergarten teachers will be doing kindergarten screening in small groups those first 2 weeks.
Yeah.
Just because for a kindergarten student not to have met his or her teacher, and for us to not have that baseline data. So if we do start on the 24th in remote, and actually this is like new news, so if we have teachers on this, they're going, what? But nobody would be surprised. I just say what we're talking about, but we're going to have to find a way to do kindergarten screening, similar to we're going to have to do a way to do evaluations and follow our RTI process and do our assessments and do those things. Kindergartners will get to, with their parents, get their iPads when we do iPad pickups. It's going to be up to mom and dad to help set them up. But one of the things, and we're doing iPad pickups next week, which is a week and a half before school starts, but we want teachers to start communicating, and we want to be able to get those things starting to go. But yeah, kindergarten, we did switch, Dr. Miranda. We had about half of our schools that were half-day kindergarten, half of our schools that were all-day. We switched them all to all-day kindergarten, and all-day every day, technically, because if you end up in a hybrid model where you've got kids coming every other day, that wouldn't work for alternating day or half-day kindergarten. So we switched all of our buildings, and for the first time this year, Hilliard will be all-day kindergarten for all of those students.
Yeah, good. Well, we have pre-K as well. So what we are planning now is how do we have orientations for our students with their teachers online. So we are planning, what does that look like? You have your appointment time, and this is your teacher, and you're meeting with your teacher and your family to give you an orientation of what the school years look like. So we're still planning that, but we think that would be a worthwhile endeavor for us to engage our students. When you think about, what students get excited about, and they get excited about the first day of kindergarten, and they're seeing their teachers, they're doing the tour of the school building. How can we do that in a very different way? Maybe a videotape. So I think, again, the teachers are being very creative about how that looks and how to still have that engaging experience with our kindergartners, and really kind of treat them with some, with care, and still give them hope that this would not be the setting that they would be in for a long time, hopefully.
Yeah. Kind of, you're doing different things. I know, Talisa, you are actually starting school late because you're doing major professional development. If you could just very talk, the three of you, quickly, how you as school leaders are preparing your teachers for this new school year.
Yeah. Yeah, for us, as I stated before, we decided early on, before we announced that we were going all remote, that we were going to dedicate the first 10 days of the school year for to create this culture of learning where everybody in an organization was learning. We have diversity and equity training. We have training on online platforms. We have training on COVID cleanliness and safety precautions. And all of this curriculum that our curriculum team has been working all year since January, just kind of on our new curriculum materials and our multi-tier system of support. So we have an MTSS system that we're rolling out. So those 10 days will be dedicated so that the entire organization is helping to leverage student learning in this virtual platform, even utilizing other people who we would have normally utilize. So when you think about our bus drivers and our food service workers and our custodians, how can they help leverage our virtual platforms with making family calls? We want students and families to have as many touch points as we can possibly have and be able to utilize our other staff members to do that. So that's what that 10 days is getting them ready for this new normal for the 2021 school year.
Thank you. So one of the hot button issues that they've asked is how do sports fit into this?
I'll let John take that one.
That's great.
So one of the challenges that we have right now are a lot of conflicting directions for what we should be doing in public schools and sports. An order was issued by the Ohio Department of Health that was the continuation. In fact, it was the third continuation of an order that allows us to move forward with non-contact sports, those being in Hilliard, golf, tennis, cross country, and volleyball. But contact sports such as football, soccer, and field hockey can practice, but they can't play. We've had some directors of health say you should cease all sports now. We've had other directors of health across the state in Franklin County, Cuyahoga County, I think Lorain County, Montgomery County, that have recommended that you stop. And then it's a real hot button issue for parents. In suburban schools, if we stop sports, they're going to go back to their club teams. And I'm not sure we cease the activities that we're trying to stop. In fact, I would say we probably do it safer in public schools. So right now in Hilliard, we've made the decision that we're following the Ohio Department of Health recommendations, and parents are signing a liability waiver that acknowledges the fact that there is a risk associated with playing sports right now with COVID prevalent in Franklin County. That liability would also acknowledge that when competition begins, they may be playing students from other schools and other counties, which also has a higher risk. I wish I could give certainty of where that would be come Monday, come the next week. As I think my colleagues would agree, the goalposts, great analogy right now, the goalposts get moved on us frequently. We all watch the governor's press conferences, crossing our fingers to see what happens and how it's going to affect public schools. And we all have those weekly meetings with our health directors to see where this is going to go. So it's tough for all of us. I know that Dr. Roberts with Columbus Public Health didn't give as much leeway as some of the other health departments have given, which creates a great deal of stress for all of us when the student athletes who need their coaches in their sports every bit as much as our student athletes do. Dr. Miranda, you know firsthand that some of those athletes need their coaches. The coaches are their positive role models. In some situations, and it's been in the chat room, athletics may be a young man or woman's only outlet. It may be their thing. And when we can't give that, that creates a whole nother side of risks and a whole nother strain. So I guess I'd close on this comment, and I'll throw it to my colleagues, is the one of my biggest challenges is you get accused of being hypocritical, that you're allowing students to sign a waiver so that they can play a golf match or they can play a soccer game. And why is that more important than a student coming in and getting an education? And that's a challenge that we face all the time.
Thank you. I'm just going to try to throw one more question that somebody asked, is about the ELL children, English language learners. So in about 2 minutes before I close it out, do you have any perspectives on dealing with ELL students?
Talisa, I think this is yours.
Thank you. So last night we had our virtual session for families. Again, we are making sure we have it in those sessions done in a native tongue. How do we make sure that our students and families, because remember we have many of our EL students that may speak English that their families do not. Mm-hmm. So how do we make sure that that the families have the support that they need? So that is a strategy or engagement team has been working on. It's been so powerful to see this happen. And again, I don't want us to minimize what is happening. K-12 spaces, institutions are being forced to work closer with our families and our partners. And for many of us, we had these walls. This is our space, and you shall not come in until we need you to come in. But because of this deadly, this atrocious virus, we are having to think differently of how we engage families. So now our EL families, at Columbus, we may have 100 languages, and how do we make sure that we have the resources for the families so that they can understand who do we need to partner with to make sure that families have those resources? And we are we're doing that. And I'm so excited of the outreach and how many people that are coming to us and saying, we want to help you with these families, because we're learning that just because you speak Spanish, that Spanish may be different from the Spanish speakers on the east side versus the west side versus the north side, right? So how do we make sure that we have the right interpreters and the right supports for all of our students and all of our languages in our families? So I am just, I'm hopeful. I am just thankful for the outreach. And I am so excited about how this is going to change our organization, because we are actually literally going to cross lines that we've never had to cross before.
I really want to thank all of you. We could literally go on for another hour, but I know it's that dinner time hour. So I really want to thank all three of you. Very insightful. I think we've tried to answer as many questions as we possibly could. I want to remind folks to respond to the survey and join us again next week, August 11th, to continue the conversation with an OSU faculty member and a superintendent from the Cleveland area. So look for that and sign up with us. Again, I want to thank you. Again, these are unprecedented times and you guys are doing amazing things. But I think the other exciting thing is the innovation that's really coming out that probably we didn't even think we could do or even think of. And I think all three of you have really highlighted that innovation that is out there. And hopefully schools will be a little different when we all come back, and that we won't keep, some people have mentioned in the chat and in the Q&A that it is about time for us to move out of our comfort zone. Yes. And this has sort of forced us to do that. And so hopefully all these wonderful ideas that have come together in COVID-19 will continue to do, and we'll continue to partner in the College of Education and Human Ecology. So again, thanks everybody for tuning in, and hopefully we'll see you August 11th.